Good evening. Thank you for joining us. This is a really important conversation, so I'm really glad we've got the perfect guest for it. Dr. Shahid Jameel joins us right now. He's a virologist. He was the former chair of the Scientific Advisory Forum to the Government of India. He's been tracking the movement of COVID in India very carefully since, well, COVID actually started, and even before that, he spent a lot of time talking about contagious diseases. Now, Dr. Jameel has given us time, so I'm going to get straight to it. Dr. Jameel, actually, why I wanted to have this conversation, many states have begun opening up. And we're seeing really worrying visuals of people moving around in malls, in markets, perhaps crowds that we haven't seen in a while. And it seems to be this triggering anxiety, at least for me, when I see large groups of people coming together. But do you think we're ready for unlocking right now? Do you think that we should have waited a little longer?
Well, the economy has really been suffering, and the unlocking is being done based on the number of active cases in any district. So it's a scientific way of doing it, and one can continue to argue whether the numbers are right or not, all of that. But at least there is a metric to do that. But there also has to be an option on the table that if the numbers start going up, the lockdown will come back. And all of us need to be responsible and need to follow protocol. Yes, I understand that people have been cooped up in their homes and they want to get out and they want to visit malls and all of that. But everyone has to be a bit responsible. And I find it frankly quite amazing that public parks have not opened, but cinema houses and restaurants and malls have opened. That really goes against what we have been learning about COVID, that it transmits best in closed indoor spaces, especially spaces with air conditioning. So that logic I fail to follow.
Now, the UK, having vaccinated a far larger portion of its population than we have, has in fact pushed its unlocking by 4 weeks because it's worried about the Delta variant that incidentally originated in India. Should we be more cautious if they are being so cautious, having already achieved greater numbers of vaccination? Should we be more cautious?
No, we should be more cautious. The Delta variant, as far as my information goes, is now about 1/3 of all the virus that is circulating in the country. So that's a lot of that Delta variant. Now, before people start getting too worried, let me just say that the Delta variant is no more lethal than anything else. It's just more transmissible. So, if the original Wuhan virus, one infected person would infect 2 others. The Delta variant, one infected person will probably infect 3.5 to 4. And remember, this is exponential. So that's why we need to worry about. Now, coming to the UK example, what you must have also seen is that UK has not just delayed its opening, it has also reduced the duration between 2 doses of the AstraZeneca vaccine, which is Covishield for us, which is the mainstay of the UK vaccination, just like Covishield is for us. They have gone from 12 weeks to 8 weeks. In India, on the other hand, we are going from 8 weeks to 12 weeks to 16 weeks. And in the most vulnerable population, which is above 60, UK has reduced it to 8 weeks. We haven't done anything like that, although we claim that the decision to go for 12 weeks or 16 weeks was based on scientific evidence. Now, scientific evidence is that 2 doses are required to get the right kind of protection. So I think some of these things need to be addressed more dynamically than they are being done.
So in fact, just for our audience's benefit, there is a analysis that has come out from the Public Health England, PHE, against the Delta variant, which is, as the doctor said, is the most prominent variant in India, at least at this point. Now, it looked at basically two types of vaccine, Pfizer and AstraZeneca. Pfizer, we don't have access to, so we'll set that aside. Let's look at AstraZeneca, which is a Covishield one that we're using. It said basically that it gives you 60% protection against the Delta variant if you've taken both doses of Covishield. If you've taken only one dose, it's about 30% protection. So
33%.
33%. So a large number of us, Doc, have taken only one dose so far, and we are waiting this wide 3-month gap for our second dose. Also, while I ask you about that gap, which you just actually talked about, we understand for students going overseas to study, for people who've got jobs overseas, and for athletes going to the Olympics, the gap is being shrunk down. So where's the science in that? We were told that the gap needs to be widened to give us better protection, but it doesn't seem to be the case right now.
No, it doesn't. It doesn't. But the Public Health England study is a bit nuanced, and let me clarify that. The numbers that you just quoted, 67% with both doses and 33% with one dose, that is for symptomatic infection. Now, today, Public Health England came out with another number, and that is for serious illness and hospitalization. And their Covishield protects very well. In fact, it's in the 90s. So, the vaccine will protect very well against severe.
But in the 90s, not with both doses or with only one dose?
No, both doses. Both doses. Yeah.
So what happens with one dose against severe illness and hospitalization?
I think I have that number. Let me just look it up. I don't remember it offhand. Yeah, so the AstraZeneca vaccine with one dose, it's 71%, and with two doses, it's 92%.
Right, and that's still a pretty good number for us.
Yeah.
I want to just examine for a second our vaccine policy. Now we are at about 4%, less than 4%, fully vaccinated in our entire population, which we must be honest about is a really small number. The Dr. V.K. Paul of the NITI Aayog has said it will be ramped up starting next week. We've also had some voices from the medical fraternity who have said, don't attempt to vaccinate everybody. Make sure that your main focus groups are fully vaccinated. Do you believe that our vaccination policy needs relooking at?
Well, I believe that we started with a very good vaccination policy to vaccinate healthcare and frontline workers and then vaccinate people who had the highest risk of mortality, which is people above 60. But, on popular demand, we just opened it up for everyone. And as a result, we don't have enough doses to vaccinate just about anyone. So yes, I think people who are more vulnerable need to get both doses on priority. I would not worry about, I have a conflict of interest because I'm not 20, but I would not give the same weightage to a 20-year-old that I would give to a 65-year-old.
Right.
We really need to protect people who are most vulnerable. Yeah. So I think dynamically, the policy has to be looked at.
Also, we know that rural India is not as well covered as urban India. So the 65 plus group that you're talking about, or the 45 plus group that you're talking about, the people we know personally in urban India might have gotten both doses, but that's not the case in rural India. Should there be a larger focus to solving that problem?
No, absolutely. And just today, I saw the number, and it was something like 14.7% rural India and 27.2% urban India with one dose. So there is almost a twofold higher number in urban India. Now, if 70% of India lives in villages in the rural sector, uh, then I think vaccines need to reach there. Now, there could be several reasons why this difference is there. It could be access to vaccines. It could be access to registration for vaccine. COVID requires you to know English. COVID requires you to have, a smartphone on which you can book it. Uh, it could also be vaccination points. There may be many more vaccination points in cities than in villages. Uh, it could also be vaccine hesitancy. I mean, we see that people in rural India are more sort of hesitant to getting vaccinated than people in cities who have really faced the brunt of this. So it could be a mixture of things. And I think the problem needs to be looked at and solutions found. But yes, this rural-urban divide is disturbing. And by the way, over the last 3 months, this divide is increasing, going from a ratio of 1.3 to 1.6 to now 1.8. This divide is widening, and that's worrisome.
So I'll tell you why also I wanted to have this discussion with you because of conversation about a third wave. I'm going to ask Ira, who's my producer, to share a couple of stories from the international press on the screen. The first one is Fox News that says, and the headline reads, UK substantial third wave of coronavirus Delta variant. That basically the Delta variant is leading to a massive third wave in the UK. Whenever we managed to put that up. It also, the next story is from the Japan Times that talks about a fourth wave of, there it is, UK to face substantial third wave because of the Delta variant spreads. That's what experts are saying. The Japan Times says that the national fourth wave of coronavirus in Japan. The Times.co in the UK says Johannesburg in South Africa is overwhelmed by a third wave of COVID cases as well. The Guardian talks about vaccines and oxygen running out as a third wave has now hit the country of Uganda. So there is definitely, now we're reading, just like we had the last time, about the third wave in different parts of the world. That now brings us to the question of the third wave in India. Is it an inevitable thing, doctor? Is it going to happen? Is there any way to predict when? And there have been some voices that it might be worse than the previous one, or it might not be. What do we know so far?
Well, I don't think there is really any data that can predict when the third wave will be or what the magnitude of the third wave will be. I think it would be safe to assume that there will possibly be a third wave. Whether it will be worse or not, I don't think anybody can predict. It will really depend on a couple of things. The first thing, obviously, is how are we vaccinating now and in the next few months? We really need to be vaccinating at scale. And unfortunately, there is this lack of doses right now, but hopefully that problem will be solved by July. The second thing would be behavior, how we behave in the unlock period. And as we just started this show talking about, how people are going out, mixing, no masks. I think we have to understand that we can't do that. We have just gone through some really, really tough times. Every one of us have lost. So, these things are important. And the third wave would essentially depend on that. And the third thing, which we have no control over, is will the virus mutate further into a more infectious variant,
right,
or not? So you can't predict that. But at least by behavior change, by not allowing the virus to transmit as much, we can also control to some extent generation of new, more infectious variants.
I'll ask Ira to bring you back full screen, please, Ira. The important question to ask right now, doctor, is that, as things open up and some of us will be required to go back to work, like you said earlier, we need to take precautions. And I know you have to leave, so I'll make this quick. We need to take precautions. So would you recommend we avoid air-conditioned closed spaces if we can? what is the best way to travel? What's the best way to actually go to work? The idea of malls currently terrifies me, but what's your advice at this point?
Well, monsoon is coming in most parts of the country. So keep your windows open, circulate the air as much as you can. It's not as hot as it could be at this time. And also, offices and all, we really need to put in place testing. If there is a staff member who is positive, they should know early on so that that person can isolate. So testing, isolation, testing frequently, and therefore we must also deploy other kinds of tests beyond RT-PCR to be able to test at scale and quickly. So those are some of the things that will have to be done. How do you travel? Well, public transport, most people will have to take. You can't avoid that, but make sure you are masked up, if possible, double mask, wear your masks properly. Those are the precautions that one has to take. It is really this simple, basic things. There is nothing fancy here. But if we just follow simple, basic things and follow them religiously, we will help ourselves and we'll help everybody else.
Doc, again, not only has, a large number of urban people, larger number of urban people than rural people been vaccinated, even in urban India, it is those who could buy those private sector vaccines at 2,000 rupees a pop who've been vaccinated, or people who work in formal offices. Would you recommend actually that those of us who can afford to work from home, continue to do so, and the vaccine process turn its attention to those who have to go to work, who work in construction, for example, who work in factories, who cannot work from home, who sell food?
Absolutely. That's very sensible. So, I don't have to be in my office to do what I do all day. So there's no reason for me to be going there. And employers need to understand this as much as everyone else, because employees at the end of the day won't have the power to decide. It is employers who have the power to decide, and they need to be sensitized to this, and they should not ask people to come unless they're absolutely necessary.
So if I were to now quickly recap what you have said, you've said yes, there will be a third wave. There is no way of telling whether it will be lighter or worse than the second wave that we have seen. The only way to be properly prepared is vaccination. We need to focus on those above the age of 65, vaccinate them with both doses. Healthcare workers, anyone who has to go to work and doesn't have a choice must be vaccinated with both doses. And that is urban and rural India together. And we have to, as far as possible, avoid crowded places and avoid closed spaces. Is that correct?
Absolutely.
All right, Dr. Jameel, thank you so much for giving us your time. I know you're a very busy man. We appreciate it. For our audience, continue to write to us with your questions and we'll try and get them answered as often as we can. Thank you for watching. Stay safe.